Mr. President.
Senator from Michigan.
Mr. President, this week we have an opportunity to lower health care costs for the American people. For months, my Republican colleagues have refused to extend existing Affordable Care Act tax credits that help nearly 22 million Americans afford quality health care. These tax credits have been one of the single most successful tools to ensure that every American has access to the care that they need. And as we near the end of the health care enrollment period for the new year, Michiganders are experiencing the real-world consequences of my Republicans' actions. Right now, folks across Michigan are shopping for 2026 health care coverage. And when they log onto the marketplace, they are seeing staggering price hikes for the exact same coverage that they currently have. For example, this year, an average plan for a 26-year-old living in Michigan's Upper Peninsula cost about $340 a month. Next year, that monthly payment is scheduled to double, costing them $600 to $800 per month. A family of four living in Detroit paid $980 a month in 2025 for the average plan. What that same plan would cost now if Republicans allow these essential health care credits to expire, well, that family is now going to be paying $2,700 a month. And finally, let's take a 64-year-old couple living in Kent County. They currently pay roughly a $600 monthly premium for their coverage, but soon that cost will be over $2,000 a month for just their premium if Republicans continue to block these health care credits. And remember, these monthly costs don't even count towards their deductibles. Folks will still have to pay more before their insurance even kicks in. It's simply unacceptable to let these subsidies expire, and every single member of Congress knows it. Working families cannot afford these increases without sacrificing other necessities, especially as inflation is making the cost of everyday goods more expensive. We know the Trump tariffs are adding thousands of dollars of cost to the average family each and every year. As a result, too many families are being forced to make a gut-wrenching decision to go without their health care coverage altogether. According to data from the Centers for Medicare and Medicaid Services, nearly 14,000 fewer Michiganders have enrolled in the Affordable Care Act plan compared to this time last year. That's almost 14,000 Michiganders who may have to go without health care all of next year because my Republican colleagues refuse to act. And we know that when less people have insurance, it drives up the cost of health care for everybody else in the country. There's no question that America is facing a health care affordability crisis, and these credits are the best tool we have to provide some financial relief right now, for families who desperately need it. But Republicans have made it clear, time and time again, that they are perfectly fine letting this program expire, all the while offering no true alternative vision for how we can keep health care costs down for everyday Americans. But Democrats, we're not going to sit back. We're not going to stall any further. This week, the Senate will vote on a bill that would extend these critical tax credits for 3 years. This common sense proposal would protect access to affordable, comprehensive health care that helps keep American families healthy. Simply put, if we pass this bill, we could literally save lives. That's exactly why I voted to pass the Affordable Care Act into law during my first time in the U.S. House back in 2009. And this week, I will proudly vote once again to make health care more affordable and accessible for every American. That's who we are as Democrats. That's what we've always fought for, because we believe that access to affordable health care is a fundamental right. For the sake of hardworking Americans in Michigan, as well as all across our country, I hope my Republican colleagues will join us in protecting that fundamental right.